ahead and call our Human Service Board meeting to order. By way of roll call, present in the room is Barbara Sheldon, Kathy Christensen, Chuck Bornhoft, Ken Borzik, Peggy Krause, myself, Barry Walters. Absent is Scott Kempley, Tim Jawaziak, and Damaris Tome, although I understand Damaris will try to pop on virtually. Our second item on the agenda is to review, and there she is. Hi, Damaris. Is to review and approve today's agenda. Are there any additions or corrections? If not, I would entertain a motion for approval.
Move to approve as presented.
Second. Motion's been made and seconded to approve today's agenda. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next item is to review and approve the minutes of our October 6, 2025 meeting. Any additions or corrections? If not, I would entertain a motion for approval.
I'll move.
Thank you. Second.
I'll second.
Motion has been made and seconded to approve the minutes of October 6, 2025. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion
Abstain.
carries. That's right, you were gone. You abstained, you said? Yeah, thank you, Chuck. Citizens inquiries and concerns. Do we have anybody online, Danny?
Nope.
Okay, and there's no one in the room. Any introductions, Mandy, at all?
I don't think so. I think everybody knows who Brandon is, but other than that, well, maybe they don't. I don't know.
We
But
do
he's
now.
been here a couple times.
Yeah. Does anybody not know Brandon? He's gonna be our new VA officer when, all right, our next item then would be our Veteran Service Officer report. Brandon.
Right, so we've closed 13 cases since our last report. We've got 100 others that we're currently working on. We have 11 cases before the Board of Veterans Appeals. We had 2 veterans pass away since our last report. As far as our outreach goes, we had our fall training conference. We had our continuing education credits so we can stay, keep our certifications, and that went really well. We had some good training. As far as, we also had our District 6 American Legion Conference in Montello, which was really good. Leaders of the league and post together. Upcoming events, of course, we have Veterans Day, which is always a busy week for us. We've always got a lot going on. And on the 15th, we have the Nishboro American Legion Spaghetti Dinner. All welcome to attend. I'll be cooking. If you want to see how good or bad my food is. The Department of Defense is still moving forward with issuing DD-214s for reservists and National Guard members, which is a huge step in the right direction because for many years they wouldn't do that. It was very difficult, even though they were eligible for benefits, to apply because they just never had the right document that the VA wanted. It amazes me that it took this long for them to finally fix this, but they are fixing it now. So that still seems to be moving forward, which that's great. That's going to make everyone's life and job a lot easier in our office. Obviously, the government shutdown has affected the way the VA is processing claims and how open some of their offices are. So the Milwaukee regional office is closed due to the government shutdown right now. Now we're still able to submit claims and there is still some limited staffing. Medical staff is still at full capacity, but as far as the claims processing side, that has slowed down quite a bit. But that should be changing here within the month, so we're looking forward to that. The VA is increasing their funding to combat homelessness. They're issuing $818 million to various organizations across the country, NGOs, that sort of thing. We're really hoping that we're going to see that kind of open up some new programs in the state because homelessness has always been an issue, especially in our county, because we're kind of dead center between where the VA has all of the, and even the Wisconsin Department of Veterans Affairs as well, where they have facilities. That brings me to the next thing, which is that the VA, of course, did shut down the WDVA, the Wisconsin Department of Veterans Affairs, did shut down Chippewa Falls and Green Bay, their locations for homeless veterans. we've been pretty fortunate this year where we haven't had very many. We had one last week that I was able to house and get into an apartment, take care of without having to use outside help. We took care of it, in-house within the county, which was great. It was an elderly veteran, on a fixed income. So that's always been something that we're working with, but the state is doing their best to try to work that program out. One of their programs is VORP, and they had 16 regions and they're now simplifying that down to 11. So they're consolidating areas. We're hoping that's going to be positive because we'll have less moving parts, but it does mean that you're going to have less personnel working the different regions. So it could be, we'll see. It's kind of a wait and see how that's going to affect our ability to house people, but it's a good program and we've had some good people in our area on and off. That's all I had for my report. Got my schedule of vouchers if you'd like me to go over that.
Yeah, does anybody have any questions, for Brandon or his office? Hearing none. Thank you, Brandon.
Thank you.
Human service reports?
So we'll go into the director's report, Mandy.
Just a couple of updates that I want to cover. We did have our person, her name is Kim, started in the clinic as our CCS case manager, so that was exciting. Continue to recruit for therapists. We had one interview and we're negotiating with a candidate. That's good. I'll be honest, I'm not super hopeful. Don't mean to bum everybody out, but we were excited about the interview and I think he'd be a good fit, but I don't know that we're gonna come to terms on pay and other things, but I'll keep you posted. We did have a resignation in our economic support unit. At this point, we're gonna hold off refilling that position. There's just too much up in the air in economic support programming. Prior to the government shutdown, there was just too much up in the air with regard to programs and how we're gonna do that. And so at this point, we're just kind of monitoring that situation closely and we're gonna leave it open. I think the last thing we wanna do is advertise and hire a person and then find out that funding at the state and federal level are gonna be cut and that we have to lay that person off. So we're just gonna sit on it for a little bit. We'll keep you posted as to if we change our minds or whatever. Obviously, that position is still in our budget and that sort of thing, but there's too many unknowns and we're not sure what it's gonna look like in our 9-county consortium and that sort of thing with staffing. So we're just gonna leave it for now. We are in the process of doing a soft launch is what we're calling it, or we're trialing our artificially intelligent phone software. We started last week, Monday. We're going to turn it off actually tomorrow. And then we have a meeting Friday morning. Myself, Jen, Dan, and Jacob and our consultant from the company. It's been really interesting. So far, so good. I think there's been some really cool features that we didn't think about, but when you call and ask it a question, it can transfer you to various places. And of course, we've tweaked some answers and I think we'll need to continue to tweak it. But one of the things that it can give people is it can text them links to information. And people really seem to like that feature. Like, oh, would you like me to text you blah, 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 blah. Call center information about how to apply for benefits, that sort of thing. And people can choose. And a lot of people say yes. And then they're like, oh, this is all I need. So that's really a neat feature just because, right, we don't do that if they call and get one of us or Teresa, our receptionist now, she's not going to text them that information, but people are finding that to be really useful. So more to come on that, kind of to figure out where we're going or what we're going to do with that, but it's been kind of exciting. And then I'm sure some of the other staff and managers, especially Annette, can talk about some of the federal government shutdown and the impacts. Obviously, huge for food share because people are not getting their November benefits. I don't know how busy the call center has been. We've seen a little bit of an uptick at the food bank. Jen can talk a little bit about that too. So we've just kind of given staff some messaging because we realize that while it's an economic support program, the reality is we're going to get questions in all of our units because we're working with people about what that means and how come they can't access those things and those sorts of things. So that's really what I had for my updates.
Any questions from Mandy? Thank you, Mandy. Would you move the vouchers or financial reports? Any questions on those? Anybody? All right. Financial unit, Jennifer.
Yeah. I don't have anything to share, I mean, really to share on financial information. Obviously, the budget, we'll be waiting to see when it goes to county board, that will pass. So really that planning has been on hold. And otherwise, it's really just kind of moving into a look back period where we are just kind of reviewing the year's activities, where we're at on grants and spending, especially when it comes to any kind of direct benefits to clients. So yeah, nothing really new there. As far as food bank data, unless there's any questions for me. Food bank data for October. So we served 330 households, saw a slight uptick in October compared to September. Kind of back up to where we were at before. So we kind of had a couple months of kind of just dropping down a little bit. October ramped back up, still holding around the percentage of people that we're serving that are seniors and children. I actually was just kind of curious what percentage of our household makeup is just seniors, especially going in with all these food share benefits, just to kind of the changes there, just to have a handle on who our clientele are. So 42% of the households we served in October are seniors. So it's definitely a, you know, larger percentage when it represents the overall population that we're serving. In October, we did see 19 new households. Within the last couple weeks of October, we started to see a notable increase in people calling and people that we haven't served before. And so registering 19 is actually a bit of a record. So we're really intrigued as far as what we're going to see for November. We just don't know. We're open this Thursday and we'll see what happens. We do have, I mean, we're doing a fundraiser right now, obviously, for Thanksgiving food. That's just a general fundraiser, just an awareness. We tend to have people who then are looking for places to donate. We've seen a slight uptick in people reaching out from the community, asking how they can help the food bank. And so we've seen a couple smaller kind of food drives going on that Rochelle's aware of. There's always ones that we're not aware of. And so, you know, that's nice. But yeah, I think at our December meeting with you guys, we'll definitely have, you know, some actual data to kind of present as far as how this impacts people in the county. We have installed the new walk-in cooler and freezer that went off without any issues. So those two new units actually double the size of what we had. Pulvermacher's going to be pleased because our condenser unit on that freezer was really on the struggle bus. And so we're already just seeing a notable improvement as far as the quality of temperature and humidity control within that walk-in freezer. And we're also seeing or experienced kind of a benefit of having the larger size. We were already able to, last month, not have to turn away a food donation, which we would have had to in the past, that because we wouldn't have had enough room to store it. And so that was really our primary goal with doubling that size, was that we were seeing on average around 3 donation offers a month where we had to turn away because we didn't have enough room. So that was exciting.
That's a good thing.
Yep. And especially considering what's going on with government and hopefully what we see for the deer donation. So that kind of leads up into that. And then just kind of really promoting that heavily. So our food bank members really love getting ground venison. So this is a state program and the state picks up the cost of the processing, and we do collect deer. It'll be that Wednesday before Thanksgiving and then that Saturday after Thanksgiving. So Really, it's just, gutting it and then, delivering it here. Pay attention, there's a banner out on the road. We would really love to collect even more pounds of ground venison than we did last year. So. Yeah, and I know there's not a shortage of deer in this county, so, yeah, please spread the word. Please encourage people to time their hunts or whatnot, and we'll take those donations, so.
My husband has done that the last 5 years when he's got.
But it's real easy, because I went with him one
It
time
is.
and they just take, you know, a little bit of information, tag and your name, that's about it. And they handle everything else, so.
They do the testing for CWD.
Yeah, they do.
It meets all the requirements,
Yep.
so, yeah.
Yep. Yeah, and then Dan always got a letter saying from the DNR, I'm assuming that
Okay.
his buck, you know, did not test
Did not test,
positive.
got
and
it.
then, yeah. So they do let the donator know if it
Nice.
tested positive or not, so
That's nice,
Barbara.
Jen, is there like a website or something that refers to the state program?
You know,
How can I find more information about that?
I can definitely email you some information for sure. Our food bank website is tied to the county's website. And I'm not sure if we have something on there, but we can try to get something on there. I'm not sure what the status of the website, the county website is right now, because it's going through some changes. Did they? Okay,
Yeah,
I know Pat,
Pat's always a good partner.
he
They
partners
handle
and
that part,
promotes
so.
it. So I can, send the flyer out to all of you, actually.
And it was in the Tribune,
Yep,
and I
It
don't know
has
if it's
been.
on Facebook or not, but I could be on the.
it's on our Facebook page for the Care and Share Food Bank. Yep, it's been shared a couple times.
Okay.
But I'll go ahead and send out that flyer. Like I said, we're really trying to get the word out. Yeah, that's just really, really great thing, so.
And just a reminder that Bowls for Hunger, which is
Right,
fundraiser for a variety of different food pantries and Marquette, Washera, and Adams County that the Westfield schools do, is scheduled for December 1st from 4 to 6:30 p.m. So if people aren't familiar with that, the students there make these beautiful bowls. Last year, actually, they made some mugs too, and you can go and it's $10 for a ticket. You get to pick out a handmade stoneware, pick your soup and salad and a dessert and that sort of thing. And it's a fundraiser for food pantries in all of those counties because they serve students in all of those counties. So it typically is a pretty nice fundraiser for our food pantry.
I think the attendance at that is pretty huge. I know couple years ago, I was super.
Yeah, and then they also take like you can bring a
Donations.
non-perishable, donation and that sort of thing too.
yeah, and any monetary donations for the food bank can be mailed right to the Human Services Department, 428 Underwood in Montello. And payable to the county or the Care and Share Food Bank. It is a tax deductible donation, not under 501c3, but a different internal revenue code. So.
Any questions for Jennifer? Thanks, Jen. Economic support child support units.
Well, our operation continue as normal. We'll take applications for benefits. We do renewals. We're working as normal. Also, benefits are not issued for the months of November as it stands right now. There was a lawsuit filed in the courts and a judge issued the order to issue benefits. However, the federal government has a deadline of 1 week to respond to that. So therefore, DHS will keep us updated in regards to how and when and if benefits are issued. And if they are issued, they're not going to be issued like immediately. Apparently, there are only 2 vendors for the whole United States that accept those files for issuance of benefits. So I guess we'll have to wait and see how and when it will be issued. Currently, we have 1,711 open cases, and we serve 3,067 citizens of Marquette County, and they're enrolled in the food share and healthcare program. The majority is enrolled in the healthcare program. And there are 2,611 people who are enrolled in the healthcare program. Out of those, 33 are homeless and 1140 are children. So the majority is children and elderly people who are enrolled in those programs. So far, year to date, we issued $2,438,975 in food share benefits, which is an increase to the same amount last year of $25,537, which could be attributed to loss of income. Expenses are increasing because the people who we're serving stay about the same. Our call center received 13,364 calls in the month of October, which is a slight increase of 125 calls opposite September. So it's really not that much right now. So we'll see what November brings. For child support, there were no reports available for November, so I'll just give you an update of fiscal year 2025. Child support collected collected $1,658,000 in child support benefits for the children in Marquette County, which is an increase of $24,287 in the fiscal year of 2024. And the increase actually was more in the arrears, so more people who actually owed benefits to their children actually picked up the tab and started paying. For childcare, for the fiscal year of 2025, we average $189,264 in benefits, which serves about 22 children and 14 families in Marquette County, distributing $717 per child. And otherwise, we had the one resignation that Mandy already reported. Do you have any questions for me today?
Questions? Annette, I'm just curious, being down one person, which I understand the reasoning and everything behind that, but is your office able to keep ahead and up to speed on
Yeah, for
everything
right
that's
now,
going
we
on?
are.
Okay.
I think one of the benefits that we have is that we have very seasoned folks in that unit. They're all local folks, so that's helpful. If that wasn't the case, I think it would be a different situation. This was a newer worker that had worked for us for a year, and it's a really challenging position. And I don't think that it was exactly what he was looking for. And I think he found it to be quite challenging and just wasn't really able to sort of keep up with a lot of the policy changes and all the different regulations and rules and that sort of thing. So it takes about 2 years to get somebody up and fully trained in those positions. And that's why we're kind of like, okay, let's see. Obviously, we are in a consortium with 8 other counties. We're required to do that by the state. And that requires us to meet certain, obligations for call center shifts and those sorts of things based on our caseload of people that we serve in Marquette County. So we'll see. Right now, they're doing a great job. We're able to keep up. But again, that's, I think, because we have a very seasoned staff who really do know what they're doing.
We do. Barbara?
Couple questions kind of related to that. So with this consortium, so who's ever on shift, no matter what county that they're from, they can accept an application from
Yeah,
any
correct.
of the
Yes.
the counties
They're
within.
usually, I would say depends on since we are big, it's, we have about, I would say, 100 agents staffed in that call center in various shifts. So, and if there is an influx in calls, they will get a message saying, hey, if you wish to keep your place in line, we can call you back at a later point too. So there's nobody who's going to be rejected.
And then my other question, because I've heard it both ways with people on SNAP, on food share, if they had a balance from October, is that going to carry over for them, or?
That was the latest we heard, that they still can use it, that there was something that they were shut off, but as of right now, they still can
Okay.
use whatever is on their card, yes.
Yeah, so I think there was differing information. Initially, we were told that because there's only these two vendors and if the money is not coming down from the federal government, that even if I had money on my card, the money will stay on my card, but that when I went to the grocery store, that I wasn't gonna be able to use that. So initially, we were advised by the State Department of Health Services to tell our customers, go out and use it because you might not be able to use it, which in the past, that's not happened. Now we're being told that people can still use it if they have a balance on there, but it kind of changes by the week.
And then I guess a follow-up question to that. How, how long can like benefits roll over? Is it just,
If the card is used within a 12 month period, they continue to roll over. You have to use it once in a 30-day period.
So.
okay, thank you.
Any other questions of Annette? Well, thank you, Annette. Clinical Services Unit, Dawn?
Yeah, so demand has increased in the crisis program in the last month. We had about 30 calls just in the month of October. So to date, we've had 212 calls. We also had 11 calls to the jail so far to date, and we've had 22 emergency detentions. So as far as kind of how we are on track with past years, our calls look to be that they'll continue to be lower than in previous years, but our emergency detentions are about at the same pace or rate that we had in the last 3 years. So as far as the outpatient clinic and CCS, we're kind of at a standstill. We haven't been able to open many new cases in the last month. So we currently have a wait list of 22 people waiting for outpatient counseling, and some have been on the wait list for 3 months. For CCS, we have 9 people who are waiting, and some have been on the wait list for 4 months. At least with CCS, I'm hoping that after we get Kim kind of oriented and trained up in the next couple of months, that we'll be able to start taking some of those cases off the wait list, and we have a plan in place for transitioning the previous workers' existing caseload off of our current workers onto Kim. So hopefully that one will at least change. And as far as long-term placements, we currently have 4 individuals in residential placements.
Any questions of Dawn?
Sure. So the clinic staff the last 2 weeks of the month waged a penny war to just internally to raise money for the food bank. It ended up being all the other staff against Dawn, but we raised $338, which is 9.5 meals.
How much money did you raise?
$338.
Oh, wow,
So 9.5 Thanksgiving meals.
9.5 Thanksgiving meals.
that's
Yes.
awesome.
It was kind of fun. I know we were trying to support Dawn with her pennies, but she had a really big jar. And a lot of silver.
Yes.
Very, very cool. Thank your staff for doing that. That's
Mhm.
awesome.
The only other thing I wanted to mention about the food bank, because I know we asked before, and it was in the the vouchers, was that we came in at $78,013.72 for the freezer and electrical for the freezers. So that was on the vouchers on page 16. Did get that invoice from Paul and paid that.
Okay, our October CCS coordinating committee meeting, as with CST was canceled for lack of agenda items. The results from the surveys had not been returned yet, so those will be compiled, and then we will have our next meeting in January. Children and Family Services Unit, Jessie.
Hello, everyone. Just want to give you a quick update. We're holding steady at 4 kiddos in out-of-home care, one of them being in a level 2 foster home, 2 of them being in a court-ordered kinship, so a relative care provider, and then we have 1 that's remaining in residential care at this point in time. The other things that are kind of we are my DHS staff in my unit, so our Children's Long-Term Support Waiver Program, as well as our Birth to 3 program, we are starting our audit from Metastar. So we have a whole month to kind of go over the randomly selected kids files that the state has chosen. So we are all hands on deck, making sure everything is a-okay with everything. The first week of December is when Metastar is going to go through that with a fine tooth comb. Fingers crossed, we will be successful just like we have been in the past years, but it's always that stressful time, making sure literally all of our I's are dotted, T's are crossed. It's that meticulous. So we're working on that. The other thing, just as an internal thing, I decided to request the DCF, our Department of Children and Family, to do an internal audit on our access reports. Access reports are our reports that we collect from the community members in regards to child abuse and neglect concerns. There are certain type of questions that we have to ask and we have to document, things of that nature. I put in that request back in June, July-ish, and I was expecting to have the results sometime this week, but the state has not completed that yet. So I'm hopeful by the next time that we meet, we will have some results for that. The CLTS audit, I'm probably assuming maybe in January, I'll be able to report on that. So,
All right.
that's all I have.
Any questions of Jesse? I used to access reports, so yeah, I know.
I have seen some of them actually, to be honest with you. They continue to pop
You
up
don't
still.
want to do those again, Mary?
No, I do not. I'm happily retired.
I bet your Ron's taking an access.
Yeah. Yeah. Any questions at all of Jesse then? Thank you so much. Aging and Disability Services Unit, Jen.
Yeah, so a little bit of change for our nutrition program. One of our long-term meal drivers who works part-time has decided to retire for a second time. So Michelle has put in her resignation / retirement from us. So like I said, she's been driving for over 10 years now. And yeah, she thinks it's time to take a little bit of a break.
She's having a big birthday in December and retiring right after that, so.
Yeah. She did give us over a month's notice, so that's a really good thing. Yeah, so I just appreciate the years that she has given to us. She has compassion and care for all of the people on her route, and she loves them, and I know she's going to miss them. But so we'll have a little bit of a change there pretty soon. November, December newsletter is out. If you didn't get one, we can grab one. I have a couple more. Just some updates. Stepping up your nutrition is happening in Endeavor this week. So November 5th, you can still enroll for that. Reminder, open enrollment for Medicare ends December 7th. So if you need an appointment, get your appointment scheduled. Caregiver Appreciation Celebration is November 14th. That's in Harrisville. You can also register for that to attend and participate and help celebrate the caregivers in our county. And check the newsletter for all of the support groups and memory cafes. We have several over the next 2 months. And then updates related to out-of-home placements. So right now we have 29 out-of-home placements on our radar. There's 2 more that are in the court process. We're currently continuing to pay for one of those. The rest are funded by other means. And then our numbers for connection and outreach through the ADRC, phone calls and stuff continue to be consistent. Something that was very interesting for me when I was pulling together the numbers is that for our website, for whatever reason in October, we had 1,317 individuals who sought out the website, which is double what we normally have. which when I saw the number, I actually reran it a couple of times and refreshed it because I wasn't really sure that that was the number, but that's the number. And then I kind of dove a little bit into it because I was like, all right, who got a hold of our website and what's happening? And predominantly, because it breaks it out by countries, and so the majority of them were from the United States. I was kind of worried that a different country had gotten a hold of our website and sent us a lot of hits or something, but no. And on October 2nd, for whatever reason that was, we had this huge spike. So there was like 340 some hits alone on that day. So, and the things that were sought out, information, resource, how to contact us, but food, fuel, and housing were the top in October. That's what I have.
Any questions of Jan? The Transportation Coordinating Committee will be December the 4th. And then our ADRC Advisory Committee meets this Thursday, the 6th at 9 o'clock in the morning. So, upcoming events and issues for discussion only. Anybody have anything there? I just have an update. When I reported last month, and I told you that about the weatherization program with CAP. The federal funding for that has stopped, but the state also has funding for that. And that is continuing. To what extent, that covers, I'm not sure. But if you know of anybody who's interested or needs weatherization services, please have them contact CAP because there are some funds that are provided through the state for that is not affected by the federal shutdown. Okay, and our number 8 is our next meeting date, time, and topics. Our meeting would be the first Monday, our regular meeting day, December the 1st at 1 o'clock. And our education presentation will be by CAP Services at that meeting. So thank you, Mandy, for reaching out to Nicole and setting that up. So if you have any questions.
About a little bit before the meeting, but wanting to recognize Chris.
Yeah, well, yeah, we'll do that on December 1st. For his years of service, so. Anybody else have anything for today's meeting before I adjourn? Anything? All right, thank you, everybody, and the agenda having been completed, I will adjourn today's meeting. Thank you.